Hello, my name is Endeja Lazo. I am studying physical therapy. My topic is standardization of adverse event terminology and reporting in orthopedic physical therapy, application to the cervical spine. Definition: orthopedic and traumatology physiotherapy is a specialist area that focuses on a pre-evaluation, diagnosis, and treatment of musculoskeletal injuries.
This video is how to apply a cervical collar to an unconscious or conscious patient. When the collars appear, they come flat packed, so in order to assemble them, you have to fit the black stud through the only hole through which it will fit to produce the shape of the front of the collar, and it's also important to try and kink the back for when you insert it onto the patient. This would be an appropriate collar, but you'd size it from the chin to where the trapezius muscle joins the neck, not the angle of the jaw to the neck, as is commonly done. So on this side, it would be chin to the neck. This is then measured on the collar from the black stud that you use to insert it to the bottom of the yellow plastic, not the white foam. So it is an appropriate size of 3 fingers. You then remove any jewellery around the patient's neck because that can produce an artefact on X-ray and generally obstruct the collar. So you'll then insert it under the unconscious patient. And secure.
Application in physical therapy. Orthopedic manual therapy is a modern, safe, effective, and proven methodology, really useful in the assistance of treatment of musculoskeletal dysfunction of the spine and extremities. The main objective of orthopedic physiotherapy is to range mobility for an injured and coordinate functioning of the human body.
This video is going to show you how to apply a cervical collar to an unconscious patient. So we begin by sizing the collar with the cervical spine secured by somebody else. So you measure from the jaw, chin, to the trapezius muscle at the back, not the angle of the jaw to the trapezius. So on this patient, it is 3 fingers. You then measure on a collar from the black stud to the bottom of the yellow plastic rather than the white foam. So 3 fingers is the right size for this patient. Some of the collars come flat packed, in which case they need to be assembled. This is done by fitting that same black stud through the only ring through which it will fit, and also producing a kink in the back of the collar for ease of insertion. So with an appropriately sized collar, you insert it under a patient's neck. And then secure it. You then want to use sandbags and tape to effectively secure the C-spine. So you place the sandbags in place and they can then be compressed by your assistant. And then you tape the sandbags in position, making sure that the tape is attached to the bed frame, the sandbags, the base of the collar, the sandbag and the bed frame, and then the same again at the top.
Pros and cons. In the pros, improve joint mobility and improves radial to tissues. Decrease muscle tone, so it's very effective for the treatment of muscle contractures. In the cons, orthopedic is a method that requires extensive knowledge of anatomy and how an injury works. ISO played in Ecuador. In the population taken as part of the study carried out at the Physical Rehabilitation Center in the city of Guayaquil. It can be pointed out that 55 patients had American low back pain, where they developed symptoms such as pain in the lower back. After the initial session, the patients were rehabilitated through orthopedic manual therapy with direct structure manipulation science made, which is why the month of August is set again, where the BAS scale established that 35% patients of the study seem no longer present any pain. These represent 64%, while 27% indicate the pain is a little, and only 5% have moderate pain. Conclusion: orthopedic physical therapy is a very important branch of physical therapy in cervical spine injuries, through a good anatomy knowledge to meet the high standard for this method. Thank you.